Well, Minister Ashford is with us, and I've asked to talk to you again because of the whole situation that's kind of changing by the minute. The UK and their virus alerts have gone out. The potential here now that you could potentially make people quarantine themselves and that sort of thing. Can you give us a rundown where we stand now and where do you feel the Isle of Man is in this whole thing?
Well, the first thing I need to emphasise is that the order that's being brought before Tynwald and is already in force is purely precautionary. It mirrors what has happened in the United Kingdom, and it's sensible that we have those powers as well, so that in the event that we detect someone with the virus and they refuse to isolate, we can forcibly detain them in order to isolate them from the wider...
detain?
Yeah.
How did you get that law through? I mean, was it just put through as a council minister nod thing, or have you discussed?
It's an order off the public. It's an actual formal piece of secondary legislation, an order flowing off the Public Health Act.
Okay. I mean, people are starting to get worried now. I mean, I think when we talked last week, it still seemed quite remote, but every day there seems to be that nudging thing that at some point there's going to be a confirmed case here, only because it seems to have gone everywhere else and someone's going to be coming back from Italy or something like that. How do you feel about it?
I mean, obviously it's a concern and the department's treating it very seriously. The very fact we've brought forward the order shows that we believe it's important to have the precautionary powers. We've got to be quite blunt in the fact there is no firm way of preventing the virus spread. We know from worldwide that port checks don't work because the only check that can be done is on temperature. Not everyone, when they've got the symptoms, displays a temperature, and equally those which are in the incubation period when they're still infectious, the 14 days, they don't necessarily show a temperature either. But what is important as well is that people do not overreact. The risk both here and the UK is still classed as moderate to low. That will obviously be being looked at again by Public Health England. Public Health over here has been engaging with the Chief Medical Officer in the UK, and we obviously follow advice.
If they jump, you go with them, do you?
Yeah, we will mirror. Because it is sensible with our free movement between the UK and here that we mirror any precautions that are taken.
Got that bit of water which should give us some potentially a bit more protection, but if they said there's no more flights to XYZ, we would follow suit.
But equally, we've got to remember it's just as likely that it would be someone, a resident here returning from abroad, that could potentially bring the virus over. We've undertaken 16 tests now on Ireland as a precautionary measure, and to date they have all come back negative.
Are these people that are coming forward to say, I've been somewhere, or I'm a bit worried, I've got sniffles, or what?
They're people who are actually presenting with symptoms and also have the travel history as well.
Now, there's some sort of mobile unit up at the hospital. Is that up and running? Is that what people do? They don't go to the hospital, they don't go to their GP, they go to this box, or is that
not
running?
What people do is, in the event, the advice has not changed in this regard, in the event that they have the travel history and they're developing symptoms, they should call their GP, not attend their GPs, but call their GPs, or if it's out of hours, call meds, and then they will be given appropriate advice as to what to do.
Because the UK is a 111, we don't do that here, do we?
No, we don't. So it's out of hours, it's the meds service.
Meds, not 999?
No, not 999. They call meds first of all, and they will receive then appropriate advice relevant to their symptoms.
So, worst case scenario, the UK has a big outbreak, which they are planning, looking at Boris this morning talking about it, and we step up our thing here. And let's suppose we have also major amount of people. What happens? Have you got Noble's Hospital sorted, or do they go into isolation somewhere else? Have you taken a hotel over, or what?
It will depend upon the condition of the person. One of the things we need to remember is even people with coronavirus, they're not all hospital admissions. In fact, 80% of cases worldwide display mild symptoms, so that means that they can self-isolate. So they can isolate at home even with the virus, as long as they don't come into contact with other people. In relation to those that do develop more serious medical issues, those that are the medium sort of medical category, we will be able to isolate here on Ireland, and those that are more critical up at Nobles, we have we have isolation facilities available.
For lots?
I'm not going to speculate on our full capacity at this stage, but what I will say is we have got enough, and certainly our contingency planning is in place.
What is your worst case scenario?
The worst case scenario,
how many people would you expect?
Well, if necessary, we can repurpose all the wards, of course, up at Nobles, should
so
we require to do so. So we'd stop
stuff.
Elective surgery, but I don't want to set those hairs running because at the moment, like I say, the risk is low to moderate.
I know, but it's moving by the minute. I mean, we talked the other week and it was still a very different feel. Now you can't go into any of the big shops to get any of the sanitisers because they've all sold out. I think people have suddenly decided they are going to take precautions. Don't you think suddenly it's hitting home?
Well, it is wise that people take precautions. It is wise that people do follow the advice, which is exactly the same as for general influenza, about washing hands continuously, having clean hankies to be able to sneeze within that are disposable, and also ensuring that in the event they don't have that they sneeze into their sleeve. It's the same precautions as you would for influenza, and it's wise that people are taking notice of that.